So as an anatomical knowledge, so we just talk about the alimentary canal, first one. So we talk about the oral cavity. Look at these scars. So oral cavity just formed one cavity by two sides, buccal, okay, the cheek. Then the top wall, as you see, palate. The palate covers, in the living body, it's covered the mucus. So mucus, that's we call the hard palate. So hard palate, be careful, two bone. Number one is the palatine process of the maxillary bone. And the posterior portion, so I will show you. Posterior portion is the palatine bone. Of course, in the living human body, we still have the soft palate. Soft palate is the mucus covered by the muscles. Okay, good. So that's what we call the top. And how about the inferior portion? So inferior portion actually is empty. So the base of the oral cavity is all mucus covered by the muscles. And inside we have the tongue. So the oral cavity, so look at these pictures. So we find it's divided two portions. Yes, good. See, I will show you. So my lips and my teeth, between lips and teeth, that's what we call the vestibular oral cavity. Okay, good. And behind the teeth, so that's what we call the proper oral cavity. Okay. So proper oral cavity. Go inside, see, go inside my finger, go inside where, that's what we call the pharynx. So oral cavity and pharynx divided by, that's what we call the very important isthmus forces. So isthmus forces, we can look at these pictures, okay. Yes, soft palate, ending portion. Uvula, yes, that's what we call the uvula. Uvula, by side, two side, that's what we call the palatoglossal arch. Palatopharyngeal arch. So between two arch, we have one many important organ inside. That's we call the palatine tonsil. Yes, it's belong to the immune system, but maybe 50 years ago or 20 years ago, someone said that's a palatine tonsil, always infection. Tonsillitis, even for the children. So someone would say, we just cut off it. But in modern days, we know it's belong to the immune system, so it's very important. So sometimes we just keep it. As you know, the medicine always keep developing. Yes. So the future development is belong to you. Then inferior part is the root of the tongue. So it's the first defense ring of our human body. Because the virus or the bacteria pass through here would be invade tonsil here. Palatine tonsil or lingual tonsil. So it would be infection, easy tonsillitis. So throat, sometimes we call it throat, oh, I feel pain, maybe I got flu. Yes, it's a very common symptom in the clinical situation. Okay, so we talk about the oral cavity. We must be emphasis on the tooth. Yes, on the tooth. How many teeth in your body? Yes, I think the answer is depends. Someone would say, I got 28. And maybe you would say, I got 32. Why? So I will show you why. Every human being, so we just two kinds of the teeth. So number one is we call the milk teeth. So milk teeth, that's we call the deciduous teeth. So deciduous teeth is developed only 6 months. So in the center, incisors, that's we call incisors, right, left. Okay. Developed another one. So canine. So here is canine and premolar 2. So totally we have 5 one-corded. So totally we have 20 milk teeth. So developed the first 6 months. Then 6 years old, we will develop the permanent teeth. So this one is the permanent teeth for the adult. So anyone know the first permanent teeth developed when you're 6 years old? Yes, good. It's the molar teeth. So number one, the molar teeth. And so we developed again and again. So in the center, that's we call the incisors and lateral incisors. Then canine. Canine is the sharp teeth. Yes, if you see the movie, you are very interesting with the canine teeth. Okay, vampire. So we see the movie in the vampire, they all bite the human body or bite the animals. So use the canine teeth, so straight in the neck. So now we will clarify each tooth to you. So look at this picture. So every tooth we divide 3 parts. The crown, so above, and then the neck. So the lower one is the root. So the crown, neck, and root. And inside we still have the dental cavity. So dental cavity contains the vessel, some artery, vein, and nerve. So that's what we call dental pump inside. Okay, good. So all in the dental cavity. So how about the substance or material consists of the teeth? It's very hard. That's what we call the enamels. So the hardest material in our body is the tooth covered by enamels. Inside the dentin, it's very sensitive. So it's if cold or hot. So sometimes we feel, oh, I feel pain. So please go to see the dentist. We can see this picture. So cover the root. That's what we call the cement. So the cement just cover the root, and he just plant in the mandible bone and the maxillary bone. So maxillary mandible bone, that's what we call 2 process. That's what we call the alveolar process. Alveolar process, that's plant in the tooth. So cover the membrane. That's what we call the periodontal membrane. Periodontal membrane is very important for our tooth development and grow up. Okay, so I will show you. So how the artery and vein or nerve pass through the cranial bone inside the tooth. That's what we call the apical foramen. So they pass through the apical foramen, then go inside the root of the tooth, then arrived in the dental cavity. So one more question. If I have a problem for my tooth, so if I feel pain more than others, for example, my finger infection or my tonsil infection, tonsillitis, the toothache more serious than others. Why? Can you answer my question? It's very easy to answer this question because our dental cavity, look at this picture. The cavity is limited. If inside infection, so would be swelling, but pressure would become very high. So the pain would become very serious than others. So my finger infection, no problem, because it would be swelling, no problem, because the pressure is not become very high. But the dental cavity space is limited. So finally, we just calculating the tooth for you. answer the first question. Why 28 or 32? So one by one. Number one, so we have in the center, that's we call the two pairs of the incisors. Then one pair of the canine and two premolar. Then the two molar. So be careful. The third molar tooth we call the wisdom tooth. Why? It means you become wiser than before. You just develop the third molar. I just kidding, okay. So actually, as you're 20 years old or 25 years old, so the third molar just developed. If you are 18 years old or someone is 20 years old, the third molar is not grow up. Okay, good. So that's we call the wisdom tooth. So totally hard. So we just finished the teeth.